Hi, welcome to Hill and Ponton's VA video blog. Today we'll be discussing common Gulf War claims, the syndrome, presumptive versus direct service connection, and any questions associated with that. So stay tuned. Hi, welcome back. I'm attorney Allison Reddick.
And I'm attorney Rachel Cheek.
So today Rachel and I are going to be discussing common Gulf War VA claims. I cannot express to you how complicated Gulf War claims are. You have the presumptive service connection, you have veterans trying to go for direct service connection, you have a multitude of unexplained symptoms. So this is what we're going to be tackling today, but we'll start easy and kind of just discuss what is considered the Gulf War period, where it was, and common claims associated with it. So Rachel, can you tell us a little bit about that?
So the Gulf War period began in August 2nd, 1990. And what's considered to be the theater of operations for the Gulf War is just like it sounds. It's going to be countries and areas around the Persian Gulf. So that's going to be places like Saudi Arabia, Kuwait, Iraq, Bahrain, Qatar, the UAE, anywhere in the Red Sea and the Gulfs around these areas, and as the airspace around those areas as well. So even if you didn't necessarily touch down, you could still be considered a Gulf War veteran.
I think what's interesting is that you didn't give an end date. You said it started August 2nd, 1990, but technically the Gulf War period is still going on, right?
That's right.
So I think it's important for veterans and active duty service members to know that if you're serving right now, to a date that hasn't been decided yet, you qualify for as a Gulf War veteran. I think every year they have been extending that date because we continue to have troops occupying these areas. So right now, the VA will say that the Gulf War period is August 2nd, 1990 through a future date to be set by law or presidential proclamation. So until that date is decided, which I think it will continue to be extended, anyone who served during that time period is considered a Gulf War veteran.
Very good. Yeah, that's a great distinction to make. I also want to say, I know a lot of times people kind of say like the Middle East, and they just think of this vague area without really like getting into geographical specificities. But it is important to note that Afghanistan veterans are not considered to be Gulf War veterans. So if you served in Afghanistan, these presumptions are not that we're going to talk about don't apply.
So that's only because Afghanistan isn't a part of that area, correct?
Right. It's not in the Gulf.
But we will talk about another area that Afghanistan veterans will be able to get service-connected claims for. So with these Gulf War veterans, what we've been seeing is so many veterans come back sick with unexplained medical conditions. They have headaches, they have dementia, they have joint pain. So why are they coming back with all of these symptoms?
So the actual why is kind of hard to pin down. So that's why a lot of these are unexplained illnesses. But there's so many different possibilities because of the different exposures that people may have been exposed to during service over there. So that could be things like biological weapons, chemical weapons, or just chemical exposure in regular course of duties. So like fuel, uranium was used in some of the equipment, decontamination agents, you've got pesticide, you've got smoke from burn pits, which we'll talk about, I think, a little later. Certain medications that veterans took due to counteract possible like chemical weapons, vaccinations, I think I already said pesticides, and there's also a lot of infectious diseases that are particular to that area of the world that veterans will come back with sometimes as well.
So there's a lot of variables going on. So basically, we don't know why they're coming back. It could be a combination of these exposures, but you did mention burn pits, so we will talk about that. So burn pits is an area that there were burn pits in Afghanistan. So Afghanistan, or veterans who served in Afghanistan, can try to claim conditions due to their exposure to burn pits. So like these other exposures, burn pits release volatile organic compounds like benzene. Benzene is a huge one that is highly toxic. They also release particulate matter, and they release dioxin, which is associated with Agent Orange. All of these cancers, all of these conditions associated with Agent Orange, that main component is being released within these burn pits. And I think a huge association is that all of these exposures, whether it be burn pits, whether it be chemicals, biological weapons, a lot of them have an effect on your immune system. And so these exposures change how your immune system responds due to these foreign substances going into your body. So the difference between burn pits and Gulf War syndrome is burn pits is its own separate thing, but Gulf War veterans can claim service connection due to exposures to burn pits as well. They can they have the presumptive for Gulf War syndrome. However, they also can claim exposure to what I discussed in burn pits as well, but it has to be direct service connection. So I think that's an important distinction. Is Gulf War syndrome can be presumption, which we'll talk about. They can also claim burn pits if they were exposed to that, but they would have to provide direct service connection, whereas Afghanistan veterans can only do the burn pits. So they would have to say, I served at this base in Afghanistan. There was this huge burn pit. My barracks was 500 feet from it, and I was breathing in smoke every day. I was covered in soot, and now I developed lupus. And they would have to get a doctor to say that that condition was caused because of the burn pits, which it happens. So, what are some of the common medical conditions that veterans are reporting associated with Gulf War syndrome, and kind of explain what the presumptive that Gulf War veterans are afforded?
Sure. So that was a good distinction between burn pits and then the Gulf War syndrome. So we might get into that a little bit later, but right now we're focusing on the Gulf War claims that are subject to presumptive service connection. And so what that means is if you can fulfill a certain amount of criteria, the VA can service connect you, or will grant you service connection based on the fact that you had Gulf War service and you have these certain different kinds of illnesses. You don't have to show necessarily something like, as Allison was just saying, you don't have to show a direct cause. You don't have to name, I was around, this chemical on this date. The fact that you had Gulf War service and you've developed one of these conditions it is enough for presumptive service connection. So one of these conditions that you see a lot, and we'll be talking about different kinds of it, this is more of an umbrella, is Gulf War syndrome or multi-symptom, let's see, do you know the whole acronym? Medically unexplained chronic multi-symptom illness.
Yes.
With the beautiful acronym called MUCME. And so basically what this is that's kind of a catch-all term, an umbrella for conditions that you develop with chronic, so reoccurring, doesn't go away, unexplained, so there's no medical explanation for it. The doctors can't figure out why. They just know that you're having these symptoms. If you've got symptoms that exist that are unexplained for 6 months, and you can show Gulf War service, and you develop those symptoms either during your active duty service or the Gulf War period, which is still going on, you can be presumptively service connected. So go ahead. You have a
So I think
to follow up.
I think it's important to make the distinction that you must show that there is an inconclusive etiology or pathophysiology. It's one or the other. You have to show that there is no known cause for this. And however, the known cause is all of those exposures that you had while you served in the Gulf. That's the umbrella term, but then there are actual conditions that the VA has kind of found to have many veterans have been coming back for. So, can you talk to us about some of those conditions?
Sure. So, one of the big ones is chronic fatigue syndrome, which is just like it sounds chronic extreme fatigue. And again, no explanation or underlying condition for the fatigue. So, obviously, say you were someone who has an active cancer and you're going through treatment. That's going to cause fatigue. That there's an explanation for that. But you don't have any other condition going on that would cause anything like that. You may be looking at chronic fatigue syndrome. So that's going to be things like being exhausted after doing just your basic day-to-day activities. So like you go, grocery shopping and you've got to go lay down for the rest of the day. You're exhausted even though you get sleep. A very common, actually necessary for diagnosis for chronic fatigue syndrome is mentally feeling, having difficulty with memory or feeling kind of slow in the uptake or brain fog, which is how it's described, as well as worsening of the symptoms that you experience when you're sitting upright or standing. So literally even sitting up or standing can cause you to feel, dizziness, headaches, you feel off balance, things like that. For service connection for chronic fatigue syndrome, you've got to meet some criteria. So first you have to show that you have this onset of this fatigue that's reduced your energy levels to half of its normal level. Now, how they measure that, I couldn't tell you, but I think this is one case where your report is going to be pretty important. As your you know what your energy levels normally like, what's going on with you. This is something where your word is really going to come into play. So you have to show that you've been having this extreme fatigue, reducing your energy level to half of its normal level for at least 6 months.
So, I think for that, it would be important to say that I served in the military. I ran 3 miles every day. I was in tip top shape. And then I've been in great shape my entire life. And then I come back and it's difficult for me to lift 5 pounds, or I walk a block and I get tired. Obviously, something happened within that time period where you can show that your energy is half what it used to be.
Exactly. And so there, that's it. You have to talk about your own experiences and how they've differed. So another thing that's going to be required for a VA service connection for this is you have to show that this fatigue that's come on is not due to any other condition. So you're going to want to show, examinations, lab tests, medical records that you don't have any other underlying conditions that could be causing this. So another the third requirement for a VA service connection for chronic fatigue syndrome is going to be 6 or more of the following symptoms. And I'd love to tell you how these memorized, but I've got a list here because there's a lot. So you've got acute onset of this fatigue syndrome, low-grade fever, pharyngitis, tender lymph nodes, muscle aches or weakness, fatigue lasting longer than 24 hours after you exercise, headaches, joint pain, psychological symptoms. I mean, as you can imagine, would come from all those physical symptoms or sleep problems. So again, show the VA that you've got this fatigue going on that's totally cutting your energy levels. It's not due to any other condition, and you've got at least 6 of those symptoms that I listed, then you're looking at a possibility of service connection, presumptive, if you can show that you also served in the Gulf War.
So I think it's interesting that they call it presumptive service connection, because sometimes I think getting a diagnosis for something like that is even harder than getting direct service connection, because although you don't need that nexus between the two, you still have to go through so much testing to rule out all of the other potential conditions. And you have to get your doctor to give you this diagnosis, which is difficult to do, to rule out every single possibility and then state that it's this condition where, yes, this is what you have, but we also don't know what caused it. So even though it's presumptive, it's still, I would say, pretty difficult to get such conditions service connected. But I think the next one you're going to talk about, I personally think is the easiest muck me to get service connected. So let's talk about irritable bowel syndrome.
Sure. So this is something that maybe more people are going to be familiar with. Irritable bowel syndrome that causes, abdominal distress is the nice term that the VA will refer to this one of the symptoms. So stomach pain, gas, cramping, constipation, diarrhea, anything that causes difficulty with digestion, that sort of thing, you can get presumptively service connected for. And
I think
that's
I think that's an important distinction is that it's not just diarrhea. It can be constipation as well. It can be one extreme or the other. But I think that IBS is something that's much easier to diagnose. It's something that the veteran experiences these conditions. It's a functional disorder, and they can go in and look at imaging and see what's going on. Whereas fatigue, you can't look at, and psychological symptoms and things like that are more difficult to get a grasp on diagnostically.
exactly. Like we're looking at some of these diseases, and it's the requirement is that there's no explanation. So that's going to be a lot harder. And as Allison mentioned, this is easier to measure.
So, another common muck me condition that we see a lot of veterans coming back from the Gulf War with is gastroesophageal reflux disease, which is known as GERD. Rachel, can you tell us a little bit about that?
Sure. So this again is going to be a condition that more people are going to be probably familiar with, or at least have heard. It's associated with the feelings of heartburn. So this condition is where gastric acid and partially digested food from your stomach actually goes up into the esophagus, which is the tube that connects your mouth, or the passage that connects your mouth to your stomach. And so, as you can imagine, you're having acid like hit a place where it's not supposed to be. That's going to cause symptoms like the feeling of heartburn, that pain, that deep pain, nausea, vomiting, difficulty swallowing, difficulty keeping food down. I know very severe cases can result in anemia because people are vomiting so much due to this condition that you end up losing blood. So this one can be pretty serious, but it is, again, it's a little easier to diagnose and to measure.
Another common condition is fibromyalgia. Can you explain that one for us?
Yeah, so this is one that's going to be along the lines of chronic fatigue syndrome, in that it's a little harder to get diagnosed and to get on record. So it's an illness of the central nervous system, and this happens. Fibromyalgia is manifests in with unexplained pain throughout the body, specifically pain that lasts for more than 3 months. So this is going to result in chronic, continued, ongoing pain in the soft tissues, especially in what they call the tender points. So there's certain areas of the body where it's been noted that people who have a diagnosis of fibromyalgia are going to be more sensitive. It's going to hurt. It's like the back of the head, between the shoulders, behind your knees. I believe there's 18 different possible tender points that can happen, and that you need to show that a certain number of those cause pain in order to get a diagnosis of fibromyalgia. But in addition to the pain in the body, there's also a great number of symptoms that can come along with a fibromyalgia diagnosis. So psychological symptoms, again, you're in constant chronic pain, of course. You're probably going to have some mood changes, fatigue and difficulty sleeping, sensitivity to lights, noise, certain smells, certain foods, headaches, having numbness in your extremities. The list goes on.
So it sounds like a lot of the symptoms overlap with chronic fatigue syndrome. When I review veterans' medical records, I see that when doctors are trying to figure out a diagnosis, they rule out one or the other, since a lot of the symptoms overlap. But at the end, we just need one. It doesn't matter which one. But definitely fibromyalgia is more associated with pain, whereas I would say chronic fatigue is more associated with the constant being tired all the time, the
Mhm.
fatigue, which
Mhm.
makes sense. Any other common conditions that you can think of that Gulf War veterans come back with?
I wouldn't say that they're common necessarily, but there are, I mentioned earlier, with some of the causes for the illnesses that people will come back with, there are certain infectious diseases that are found within Southwest Asia. So those aren't as common, but that is something also to look at. I'm promise you I cannot pronounce any of them.
I think it's also important to note that this isn't an exhaustive list. These are just examples of the most common ones. Um, like I had a veteran who she served in the Gulf War and she served in Iraq and she also served in Afghanistan. She was exposed to burn pits as well. So not only does she have the argument for presumptive Gulf War service, she also has the argument for direct service connection based off of exposure to burn pits. She suffered from Hashimoto's and she also developed lupus, systemic lupus. And so we went the direct service connection route and we were able to show that not only based off of her extensive exposures in Iraq in the Gulf War, but through the particulate matter and the benzene and dioxin exposed to, through the burn pits, like I said, dioxin is associated with a lot of manipulation of the immune system. We were able to get her service connected for lupus. So that's not one of the common ones, but I see a lot of veterans come back with that. They come back with autoimmune issues. So just because it's not one of those 4 examples that we gave doesn't mean that you can't get service connected for it. I think it's such a complicated area, but one, this era, this Gulf War era has been going on since 1991 and is still going on, that there are thousands and thousands of veterans that have been exposed, and they're not just going to have these few conditions. So it's important to have your doctor look over your symptoms. If you have a whole bunch of symptoms where you don't know what's causing it, it's most likely that it's something that you were exposed to in service, and having your doctor look at that or having an attorney or other expert look at your file to see how we can help show that, is very important.
That's right. Because, I mean, think about how many Vietnam veterans there are and how many different conditions are still being added to the list, how many different eligible people are still being added to that category. And that war has been over since the 70s. So God knows how long it's going to take to get all of the conditions that are caused by service over there and the exposures to get on this list.
And if you're still serving, or if you do active duty training, your National Guard or something, if anything happens to you, make sure you go get checked out. No matter how little it is, something that could bother you 10, 20 years from now. So that has nothing to do with this, but I just wanted to make it known. So going off of that, why we say that is because that provides evidence that something happened to you, or you were exposed to something. So what kind of evidence would be helpful for Gulf War claims?
So just like you mentioned, documentation, that's helpful whether it's in your medical, well, it's most helpful if it's in your service medical records, but it's also helpful in your medical records when you come back. Because again, if you can show that you worked or that you were in the Gulf War, or I'm sorry, in the Gulf area, during the Gulf War period, and you come down with any of these diseases, you develop any of these illnesses, that's a possibility. There's a possibility of getting that presumptively service connected. But as Allison mentioned before, it's often very difficult to even get a diagnosis, especially for some of these conditions that we talked about, the more complicated ones like chronic fatigue syndrome and fibromyalgia. That's something where you doctors might be hesitant to give a diagnosis at first, but it's very important that you do make sure to get any tests that you have that rule out certain causes of these illnesses and symptoms. And it's also very important, just as Allison was mentioning, when we talked about chronic fatigue syndrome, like your word is helpful. You do like statements. How else is the VA is not there? Your doctor's not there every day, every night. Like you are the one who lives with your condition and your symptoms, and you know what happens to you. So it is important to make a note, even if you don't go to the doctor, keep a journal, keep a record of the symptoms that you're having. I know we tell that a lot to our veterans who have migraines and headaches. Keep a headache diary. Keep a diary showing any symptoms that you have, because for a lot of these, what the VA is going to be looking at too is chronicity. So the continuation of these symptoms. It's not like it just gets better and goes away. It continues on.
And not only your symptoms, go back and try to remember what kind of exposures you had. Were you on a base that had a burn pit? Did you have to take methloquine to go overseas? I know a lot of veterans had to take that for malaria, and there are a lot of conditions associated with that. Did you have to take HCl tablets for tuberculosis? There's all of these different exposures. Were you involved where there was chemical warfare, things like that? I think it's important to make sure that you, if you're not servicing anymore, go back and kind of remember, okay, this is what I did. I remember they made me take this medication because I was exposed to this, or I lived near a burn pit for 6 months and they burned everything in there. Lay statements are just as important, and can be used and can have just as much weight. I mean, not just as much, but they can have a lot of weight when there isn't medical documentation, because a lot of veterans don't go for those symptoms, or they didn't experience the symptoms until after they were discharged. And obviously, evidence of getting a diagnosis from a physician is extremely important. However, as we discussed, can be very difficult because you have to rule out all of the other conditions. You have to show that there is no known cause for it. But that's what's needed in order to get presumptive service connection.
That's right, because the VA, even if you make a claim and you have symptoms, if you don't have a diagnosis, the VA can just say, well, no diagnosis, no record of this, and deny you off the bat. So that's very important to get.
But even if you don't have a diagnosis, utilizing legal minds and things like that can help you, because some doctors, especially civilian doctors, don't know, or have very little experience with Gulf War veterans and Gulf War syndrome, and understanding that all of these symptoms could have been caused by that exposure. So I think it is important that if you're having a variety of symptoms and your doctor doesn't know what's causing them, that doesn't mean give up. Seek advice and figure out if that culmination of symptoms could be due to Gulf War syndrome. And so going off of that, once you do get service connected, can any of these conditions be rated at 100%?
So it varies from each condition that we talked about. They all have different diagnostic criteria and different rating criteria. The only one of those that we specifically talked about that has a 100% rating available is chronic fatigue syndrome. So the others may range. I know IBS goes from like 0 to 30%. I know GERD goes up to 60%. That being said, you can also get individual unemployability for some of these conditions, especially the ones that go up to 60%, because you need to have a rating. If you've got more than one condition, you need to have a rating of at least 70%, a combined rating, to qualify for individual unemployability. But if you have one condition that's rated at 60%, you may qualify for individual unemployability just for that condition.
See, but you're talking about schedulally qualify. So I don't care. I'm going to try to get extra schedule consideration, because if I have fibromyalgia and I have extreme pain every single day where I can't get up, I think that's enough for you to say that, even though you're rated at 40%, you're at the top and you have no other conditions. I think the extent of that condition and how it affects your activities of daily living, let alone then it affects your ability to work. So even if you're not schedulally qualified, is it harder? Absolutely. But especially with these conditions like chronic fatigue syndrome, where it's hard for you to get out of bed every day, fibromyalgia, where you're having pain every day, IBS, where you have to run to the restroom and you're having accidents every other hour, you can definitely provide evidence to attempt to get extra scheduler consideration and get individual unemployability that way. So don't be deterred if you don't meet the requirements, like Rachel says, because I still think you can get it the other way too. So normally we talk about specific case examples, but I think it's really difficult for Gulf War syndrome or Gulf War veterans, because the means is so convoluted to the end. I think we as attorneys, what we do is we don't really have specific examples of cases. What happens is a veteran comes to us and they say, I have all of these symptoms. I don't know what's causing them. I served in the Gulf War. What do I do? So, what we do is we look at those symptoms and then we reach out to experts like rheumatologists or occupational specialists, doctors, or we even converse with their personal physician to try to help diagnose that condition based off of those symptoms, whether it's a MUCME like fibromyalgia or chronic fatigue syndrome, or whether it's a condition that may be more due to the burn pits like the lupus. I think it really is a case by case basis, and there's always going to be issues with these claims just due to the complexity. But are there any specific issues that you see when we discuss Gulf War related claims?
Well, I know something that we've talked about before is even though these are VA rules, it's sometimes difficult for the VA to follow their own rules. So we've been talking about, Gulf War syndrome and these conditions that are subject to presumptive service connection, which again is like we've talked about is not as easy as it sounds. And then we've also got the claims for direct service connection. So that would be like specific exposure to the burn pits, or if you can point to a specific incident that happened in service that caused whatever you're dealing with. And we talked at the beginning about the different categories of veterans. So you've got veterans who served in that Persian Gulf area that we spoke about anytime after 1990. And so that includes Iraq veterans who served in Iraq after, say, 9/11. Mm-hmm. So that includes those veterans who served there before 9/11 and after 9/11. It does not include veterans who served in Afghanistan. And so this is something where sometimes Iraq veterans are actually they're eligible to submit Gulf War claims. So for these MUCMEs that we were talking about, but they're also eligible to file for direct service connection for burn pit claims that we've also mentioned a little bit. And the VA can mix these up sometimes. They can think that you're asking for direct service connection when you're asking for presumptive service connection, or vice versa. So it is important, if you get a decision from the VA and they're denying you, look to see, they should give some rationale for why they did that. They may have not been applying the proper standard when considering your case.
So the post 9/11 Iraq veterans and the Afghanistan veterans, they can do the burn pits, because that's really when the burn pits came into play, was when that war started and we went over there. So in conclusion, Gulf War claims are extremely complicated. I think we can all agree on that. Even though there is presumptive service connection, it's still very difficult to get, but it is possible. And there are also other routes that you can go, like direct service connection. Anything else, Rachel?
I think we covered as much as we can do in a brief video. I'm sure we could do a whole nother one on burn pits and a whole nother one on the rating criteria, the way that all these conditions are rated.
Okay, well, we covered a lot today with regard to Gulf War VA claims. Thank you so much for watching. If you need any additional information or have any questions, feel free to go to our website.
Thanks.